Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight's our yearly Thanksgiving segment, and we're going to try to keep you from getting food poisoning. Also, a lot of people have joint pain, especially knees and hips, but we've got the specialist to talk about shoulder pain. That and the hurricane health effects and what specific problems Lexington hospitals have had with the hurricane. All that and Trinity Hill Backpack Program is here. To start us off is Lindsey Clickner, who's a nurse practitioner at Family Practice Associates. Welcome.
Thank you.
Now, you always do our yearly segment on food safety and turkey, so let's start with turkey because that's what most people do. So how do we do it to keep us from getting sick?
Well, hopefully if you've watched in the past, all the tips have served you well. So we'll continue to remind everyone. Cooking poultry is something that takes great care. It can be done, and we want to do it safely. So first things first, when we talk about thawing our turkeys, right, which we typically would do, you want to do that in a refrigerator, okay? You want to do it potentially in the sink. You never want to do it on your countertop. So having a turkey thaw on the countertop can cause rapid growth of bacteria. We call it the danger zone. Anywhere between 40 degrees Fahrenheit and 140 degrees Fahrenheit is when that bacteria rapidly will grow. So thawing your turkey safely is the number one way to start a successful Thanksgiving meal. And then we're going to talk about prepping, right? Cutting using different hot soapy water, washing your hands, separating poultry from vegetables and other dishes that you might be serving. So a separate cutting board, for example, for fruits, vegetables.
You don't want to contaminate everything
exactly.
else.
It's called cross-contamination. If you do use the same surface, please wipe it down with hot soapy water in between.
Now, that's turkey, okay? But there's also other foods. You still want to be careful with other foods in terms of Thanksgiving.
Sure. You know, if you're doing a traditional meal, like you're going to have stuffing, the recommendation is cooking that outside of the turkey. And then if you feel like you need to put it inside the turkey before you serve it, you can certainly do that. You want to clean your hands. You want to separate, like we talked about. And also checking internal temperatures. It's not necessarily 100% reliable to have the internal thermometer of the turkey pop up. You certainly want to check yourself. So you want the internal temperature of that turkey to be 165 degrees Fahrenheit.
All right, so let's say you don't pay attention. They didn't watch the show these last couple of years, and people do get sick.
Sure.
Tell us a little bit about food poisoning.
It happens. So food poisoning or the stomach flu is what we call it. You can have some chills, you can have some nausea, you can have some vomiting, you can have fever and diarrhea. Now those can last up to 2 days. Anything that persists 3 to 5 days, we would say certainly talk to your doctor. People are very at risk, the very young and the elderly, from acute dehydration, and that can happen pretty quickly, quicker than what you would think. So again, if it's your child and you notice they are having a lot of frequent stooling, diarrhea, vomiting, bring them in, have them checked out, because that dehydration can set in very quickly, as it can with the elderly as well.
Any symptoms that clue you that they might be dehydrated?
Well, for example, for children, you want to count their wet diapers, right? You want children to have 2 to 3 wet diapers in about a 4 to 5 hour period. Same with adults. If you're not voiding using the restroom, especially if it's been 4 to 6 hours since you've used the restroom, you can do the little tent skin test. So if you pinch your palm and the skin tense, we call it, that is a sign of dehydration. Just general malaise, fatigue, not being as alert as what you would think normally your child should be.
And real quickly, not everybody needs to see the doctor. You can kind of try some things, rehydration at home.
And in a normal, healthy person that is not immunocompromised, your body will rid itself of this bacteria, right? So you just want to aid it. You want to make sure you're drinking plenty of fluids, making sure you're having some saltine crackers, maybe even a little Gatorade, Pedialyte, but water is key.
All right. Well, thanks for coming in and reminding us.
Thank you.
And hope you guys have a good Thanksgiving. We'll be right back.